Hello, my name's Caitlin Lenneborg. I am a doctorally prepared family nurse practitioner and recent graduate of Rush University College of Nursing. This project represents my DNP project capstone and is titled Designing a Blood Pressure Management System for Adult Employees of a Large Urban Academic Hospital with Uncontrolled Hypertension. Hypertension is a leading cause of cardiovascular disease and mortality in the United States, with healthcare workers at an elevated risk due to occupational stress, poor sleep, irregular hours, and lifestyle challenges. Despite national calls for action from the American Heart Association and the U.S. Surgeon General's call to action to control hypertension, many healthcare systems lack structured programs to address hypertension among their own staff, a missed opportunity given the high-risk nature of their work environments. This project responds to that gap by designing an evidence-based, person-centered pilot program to support hypertension self-care in healthcare workers through shared medical appointments, aligned with institutional priorities for chronic disease prevention. The objectives of this program include identifying and appraising at least 3 evidence-based hypertension self-management and group intervention programs, design a group-based pilot program tailored to healthcare workers, including a program manual, educational materials, inclusion and exclusion criteria, informed consent forms, and a leader training guide. This program was guided using the REAIM framework. Methods include a comprehensive literature review, which was conducted with assistance from an academic librarian. Databases searched include Scopus and PubMed using the following terms: hypertension, group class, group intervention, group education, workplace intervention, employee or workplace. This yielded 1,500 articles, and 20 were deemed relevant for the purposes of this pilot program. Key data points were extracted and synthesized into an Excel chart to track themes, including program duration and frequency, group size, inclusion and exclusion criteria, consent process, curriculum components, and participant materials. Among the 20 relevant articles, several high-impact programs are listed under major programs below. These findings informed the design of the pilot hypertension group program, its educational content, and associated materials. Results were 20 evidence-based programs were identified. They encompassed themes such as group-based hypertension education, lifestyle interventions in the workplace, coaching for chronic disease prevention among healthcare workers. These components were incorporated into a new 8-session group program. Materials were developed to include a comprehensive program manual, educational handouts, informed consent forms, and HIPAA waivers. Key program elements include blood pressure monitoring, medication adherence, diet, physical activity, stress management, and substance use reduction. These were implemented over an 8-week weekly program, and I have the content of these sessions briefly listed in the green table below. Conclusions: a structured hypertension self-care program for healthcare employees has been developed. Stakeholder feedback was positive, and all program materials were approved for pilot implementation. This program is designed to address the high burden of uncontrolled hypertension in the United States, as hypertension is a chronic, often silent condition that contributes significantly to morbidity and mortality. Phase 2 of this initiative will involve piloting the program with 15 healthcare employees across 8 weekly sessions, and the next phase will assess feasibility, engagement, preliminary outcomes with the goal of informing future program refinement and scalability. Thank you for your time.